Think of osteopenia as pre-osteoporosis. So you're a little bit below normal healthy bone density, but you are not yet low enough to be diagnosed with osteoporosis. When you have osteopenia, your chances of breaking a bone aren't all that high. But if you continue to lose bone density and get osteoporosis, then you have a much higher risk of breaking a bone. So when you have osteopenia, your doctor should be aware of it, and you should get regular bone density tests, usually once every 2 years. You also want to be getting the right amount of calcium, vitamin D, and getting that weight bearing exercise so you can hold off that osteoporosis for as long as possible. Some doctors might recommend a medication when you have osteopenia, depending upon all of your other risk factors, but most of the time they don't, because it's not really, really dangerous for the risk of falls, but it could become so. So you got to keep an eye on it.